Hi, and welcome to the Fountain of Life Fitness training session. We're going to be going through a weekly series of exercise sessions to help prevent loss of our muscle tone. So we're going to prevent sarcopenia, work on building our bone density, and help to avert injury and rehabilitate whatever we have going on. Each week we'll focus on a particular topic. We will do a full body training session. The first half will be the preparation series, corrective exercises, and back care work. The second half will be more of the weightlifting component. So if you just want to do the strength training today, just join in halfway through. So thank you for coming. And I always like to begin with a bit of soft tissue work, working on the pectoral muscles in the chest. And we all work on computers, so we all hold on to steering wheels. Fortunately, we do fun things like play baseball and tennis and gardening and golfing. So we need to pay attention, and we're just going to massage like this with a massage ball or tennis ball just below the collarbone. The easiest way to do that is in a door frame, and you turn the head away from the ball, and so it's, you have space here. It's easier than to do it just against the wall. Particularly, you'd like to be in the corner where your collarbone meets the chest bone, the clavicle, the sternum, and the first rib. And then work your way out with putting a little pressure at the base of the collarbone, in between the collarbone and first rib. And that's specifically the subclavius muscle, and when it gets gummy and sticky, it's hard to get our arms moving overhead properly. Okay, and then when you get to the edge, okay, you can go around the humerus edge, that's your arm bone, and right by the armpit, often there are tendons there that are kind of tight. Then we'll turn on other side, so head is turned away from the ball. The palm of the hand should be facing the wall. And keep the head relaxed down so there's no tension in your neck. And work your way out right by the underarm across the tendons. Every day it'll get a little more tight again, and you just keep working on it. It shouldn't be painful. Sometimes initially people have a lot of discomfort there. I'm now going to work on the feet. Of course, we all need to work on the plantar fascia, the connective tissue in your arch. But also, if you can work into the forefoot, there's an anterior arch at the front of the foot, between the second and third toe area. And then on the outside of your foot, there's also a lateral arch just between the heel, right at the top of the heel on the outside, and around your heel cup. Okay, then we'll work on the other foot. And if you do this regularly, it won't hurt, it won't feel like much. If you don't do it regularly, it usually can be very sensitive. The tendons get very tight and weak. Okay, good. Now we're going to do a series of exercises on the floor. They're not really stretches, they're corrective exercises to balance out your alignment. The things that you're going to need are this ball and a broomstick or something like that. You can use this feed ball. Something like a rolling pin, or probably most people have a foam roller. So I just have this really small, I have a bottle actually that I use. We're going to roll out the quads, and in a strap for stretching the hamstrings. So here I've got the hamstring. Many people have a yoga straps or a bathrobe belt or karate belt. Okay, so the first area, we're going to continue this working on the shoulders and the chest. So if you could use the ball, and we're not going to spend much time, but just a couple of areas that are critical. Here, this is across here is the upper trapezius. A lot of people have tension there from the stress of life, but lifting the shoulder blades up. So the ball goes right at the base of the neck, here I'm on the left side, and slightly over and slightly back. And you just lift up like this, so it's underneath of it, and then bring the arm up and straighten that leg. And just let your muscles let the soft tissue sink into the ball. But some people like to, move side to side over it. I find it's very helpful to just put pressure. If particularly it's very sore, you find that area where it feels hard or thick. And just put some pressure onto that and let it break down a bit. So those dense tissues, they're not allowing fluid to go inside the tissues, and so they can't regenerate very well, and they restrict your movements in life. Okay, so that's the work on the other side. So many people know fascia, the connective tissue. The arm is up in that leg. If you straighten that leg, it helps decompress the joint a little so you can have more access to the tissues. In general, the left side commonly is harder and thicker than the right side. A lot of people have a lower right shoulder. There are a number of reasons for that. Over time, we'll go through all really fascinating topics about our bodies and how to make them better. All right, so now that's the upper traps. Next, we're going to work on the gluteus medius, like in the hip. And this is the main topic of the day. This is your femur, this leg bone, the upper leg bone. And then we have your pelvis. You have this pelvic bone. You can feel iliac crest. And then this bony structure here. And there's a bone, there's structure, a socket, and your leg sits into that socket. So we're putting the ball, this is my left side, just lift the hip up a bit, put the ball just slightly under like that, and then straighten the leg. And if you turn, so you're getting on top of the ball, and the ball will sit right into a valley or a groove. And that is the top of your femur, the trochanter, the top of your leg bone. And there's a socket where it sits in your pelvis. So we're just the tendons of your gluteal muscles, the buttock muscles, attach your leg, right? They hold on to your leg so you can move your leg around, and they attach your leg to your hip. So when you put this pressure here and just relax into it, you're helping those tendons release, and you'll be able to move the leg more freely, more comfortably. So we're right in the socket of your hip. And again, you can just put some pressure. If you find a spot that's very sensitive, you might just hold it there. Okay, let's try your other hip. The right side here, you lift up, straighten the right leg, and then lift up onto the ball a bit. And again, commonly the right hip gets more sore than the left. You might be a little different, depends on a lot of factors, what sports you play or don't play. If you sit, some people sit mostly on one hip, so that hip will get a bit thicker and uncomfortable. And again, if you find an area that's a little bit more hardened, you might just let the ball sit into it. Okay, that was great. Now we worked on the hips a bit. So we're going to leave that aside for now. We're finished with the ball. Oh no, actually one more thing. We want to decompress the spine. So for that purpose, I like to do something quite simple. You take the ball right here, just behind your head and your skull. Have the arms by the sides. I'm just going to nod up and down and relax your back. And take a breath. At this moment, we're preparing our bodies, right? We want to be weightlifting and get stronger, and we need our bodies to get in order. And then again, nodding the head up and down. And take your deep breath. Now keep the chin down position, relax the shoulders. Only the eyes look up and down. This will help with balance and vertigo. And of course, eyes or eye muscles. So eyes are looking down through your body. Take a breath. There's very dense plexus of nerves in the neck and the eyes attaching to the neck. And eyes up and down again. And a breath. Great. Okay, so now we're taking the strap. So here, this I have a karate belt. The objective, as I said, here's your femur, your leg bone, and it sits in the hip socket. And a lot of us are restricted, so we want to be able to rotate. So think of your leg kind of like a screwdriver, and you're going to rotate like this in and out. So if you could take the strap under the foot, it's really important that you don't twist the knee. So my right foot, take it in the left hand around the back of the right leg. So now your right hand's holding onto it. The knee stays over the hip. If you have your leg bent a bit, if your hamstrings are tight, it can be like that as well. That's fine actually. But the knee should be over the hip joint as you do that. And you're just rotating internal like this, internal and external rotation. You're cleaning up that joint. Okay, and then take the strap apart and wind it and just do a bit of a stretch here. Always keep the knee over the hip. For our purposes, it's not better to pull your leg closer to you. Okay, switch legs. Right leg is on the floor. Okay, so left leg, the knee is over the hip directly. Straighten the leg, whatever works with your hamstrings today. Strapping right hand, wrap it around the back into the left hand. And as you rotate the leg, we're cleaning up that rotation right in your joint. That will definitely help with the bursa regenerating. Okay, unwind the strap and just do a stretch. Okay. And then we'll put the strap down. And next we'll take this broomstick. This is to align the pelvis. So the right leg, the knees over the hip, and you take the stick in the back of the right leg, pull the left leg up into it like that. So the right knee is over the hip, and you're pressing with the hamstrings of the right leg, pulling the front of the left leg into the bar. The leg should be a 90-degree angle and the arm straight. Then we'll reverse the leg position. Okay, so left leg you're pushing away from you, right leg pulling toward you, aligning your pelvis. Okay. Okay, and next, to help again with the chest and get better blood flow and cleaning up the nerves down the arms, and to clear the nerves, you take the arms out to the sides like this, like a Y position with the palms facing up. If your shoulders are not that good, then you might only do a T or even lower, but we're working towards something like a comfortable Y, palms up. And now envision a stability ball. So everybody knows those giant stability balls that we use in exercise. So imagine you've got that on your abdomen, and if you have one, you can use it, but you wrap your arms, so you're hugging it with your arms, and then wrap the legs around it like that. So this is like a cradle, and just going to rock side to side using your abs. Make sure you brace your abs as you do the rocking. If you're falling apart in the middle, just your rotational core isn't sufficiently strong, you would just hold the position instead of rocking, or just do a slight rock. But over time, if you keep coming, you'll get much better. Okay, then relax down again. We're going to do a variation of dead bug. So bring the arms up to the sky, and then bend your elbows so they're 90 degrees. Then lift both legs up, your knees are over the hips, so you should feel your abs engaged. Your lower back should not be flat on the floor, should be just a slight arch. And push the front right leg away. Don't straighten it, only 3 inches, and hold. Using your abs, hold. Bring the leg back, left leg. Often when people do this core work, they use their thighs too much, the quads. We really want to make sure we're using abs, not quads. Bring the leg back, right leg just a bit forward. Here we're doing our core activation prior to weightlifting. Leg back, then left leg. Okay, next, this is a rotational axis toward the spine. We want to keep our spine in the best order we can. You straighten the right leg, bend the left knee, and bring it over toward the right side, the left knee over, so you're lying on the right side. With your left hand, reach toward the right foot. If your hamstring cramps, you can just leave your leg back, like don't worry about that part. But ideally, like that left hand, right foot, right hand is holding onto the left knee at the front. Most important thing here is the left shoulder back, left knee forward, and they're both the same heights from the floor. Don't just roll the knee forward all the way down. It should be off the floor, equidistant to the left shoulder, okay? Then rest. If you rotate the knee, then you're over twisting your lower back. Okay, left leg is straight, right knee bend, then roll onto the left side. That right hand reach toward the left foot, left hand on the right knee, and think right shoulder is back, right knee is forward, and they're both the same distances from the floor. So commonly people will feel a stretch in your left quadricep in your thigh. The right glutes might be tight. Sometimes people feel lower back, but ideally, you just here in this position should feel pretty comfortable actually. If you're much tighter on one side than the other side, over time we'll even it out. Okay, and now turn on the back again. So now that we've gone through that, we're going to do it a little more quickly this time. So the strap under the right foot, left leg is straight, right leg knee over hip. And now the important thing here is the knees over the hip, and you work on straightening your leg, but don't overstretch your knee. So if you feel it behind your knee joint, you shouldn't feel a stretch there. Bend your knee a bit. Overstretched knees make weak knees, and they get a lot of problems shifting around too much. Okay, switch legs. You should feel a stretch in your calves and your hamstrings. Left leg, knee over hip, and straighten. I also like to pay attention to the foot. Sometimes people twist their ankle a bit. Toes and knee here should both be pointing straight back toward shoulder direction. Just note if you're twisting your ankle a little or the knee's going out. Great, and now the broomstick. Finish with the strap. Okay, so the broomstick, the right leg, knee over hip. It's in the hamstrings of the right leg. Left leg, pull up into the bar. Okay, so now we're going to even ourselves out. The shoulders, the back of the shoulders are centered on the floor. The back of the hips also stay centered. Notice if you're leaning to one side. Okay, reverse the leg position. Straight elbows. Center the shoulders, center the hips. Feet should be a little lower than the knees, not higher. You'll notice if you lift your feet up higher, you'll feel it in the quadriceps too much. Okay, broomstick down. And Y position. By this time, it should feel better than the first time, right? You've cleared your nerves, you're getting better blood flow down the arms. Okay, and now we're going to wrap our arms and legs again around that imaginary stability ball. And this time we're just going to hold. So you rock over to the left, whatever you can do, and just hold there. And be stable. And again, if you're losing control of your lower back, we're doing many things to help build that stability over time. Turn onto the right side, creep your abs engaged down. Okay, lie on the back, arms and legs down for a moment. So our dead bug position, arms to the sky, bend the elbows 90 degrees, bend the knees up, knees over hips. So abs are engaged, your lower back is neutral, not flat to the floor. Right leg push forward, your lower back should not arch more, it should stay in that neutral angle, hold there. And leg back. And left leg, you should feel this in your abdomen, lower abs. Okay, and we're switch legs. If you feel it straining your back, you can have the feet on the floor and just move the legs along the floor, left leg. Okay, feet down. All right, so now spine rotation, right leg is straight. We turn onto the right side, left leg is around. Left hand, reach toward the right foot. You might get it this time. Right hand, hold on to the left knee. And we're thinking the left shoulder back, left knee forward, equal heights from the floor. Okay, now we'll turn onto the left. Right leg comes around. Okay, right hand that reaches toward left foot. Left hand on the right knee. I like to lengthen, think of lengthening the spine from the top of your head here. From here, we're going to roll out the quads. That's your thigh muscles, the front of your legs. Many people have much stronger quads than hamstrings and glutes. So the hamstrings are the back of the legs, the thighs, the quadriceps are the front. The ratio should be 1 to 1, and most people 2 to 1, 3 to 1, even I've seen quite commonly. So here I'm using a just small foam roller. You can either just sit in a chair and roll out your quads like that. I like to do this face down. Most of you probably have a long foam roller, but I would do one leg at a time. So we're going to start here on the right leg. And incrementally work the full length of the tissues between the knee and the hip. And you might like rotate your leg in slightly different angles so you get the inside, the outside, and the middle. And when you come to the top, the tensor fasciae lata is here on the outside of the hip, the TFL. That is a muscle that attaches to the IT band. So it's a really important one here for stabilizing the knee and the hip. Okay, so now we'll do the left leg. I'm going to start just above the knee. And it's really important always, if you're doing this foam roller version, that you have really good core support, right? Your lower back should not be arching. Don't sag down. Use your strong shoulders, strong abs here. Good opportunity for strengthening yourself. And then the outside of the hip here in the TFL. And of course, you can do more of that on your own if you like to. Okay, so we've calmed down our quads. You don't see me sitting a lot, the quads will short. So we've kind of helped them release. Now we're going to work on strengthening the gluteal muscles, the buttocks, stabilizing your SI joint, the sacroiliac joint at the base of the spine and the sacrum attachment. And yeah, and the hamstrings also. This will help even out that strength imbalance that I mentioned. Okay, so I think this will be okay. You need to set up at a couch or a chair that the soft surface has to be very soft. And you'll have one foot on the floor like that. We're doing a hip lift. Many people do glute bridges or hip lifts. This is another variation for the SI. The upper leg is straight. The foot on the floor is bent. So the upper leg is in the calf, right? The chair is digging into the calf. The foot is flexed. Make sure you don't out toe with either foot. Toes are centered. Squeeze your buttock muscles. Important thing is squeeze your glutes and then lift the hips so that the hips are level. It's critical that you don't let your back arch. Just keep squeezing your buttock muscles. And then lower. Okay, switch the leg position. Left leg is up, right foot on the floor. Squeeze the buttocks from the sides of your hips. You squeeze in your butt from the sides. Don't flatten the lower back. Neutral spine angle and lift. And hold. Keep squeezing your glutes. Don't lose that. If you let the glutes go, then you'll start pulling from your lower back and hamstrings. And lower. Okay, we're going to do that again 2 more times. Left foot on the floor, right leg is up. Glutes engaged, keep the chin down and lift. Be sure you don't tip the chin up to the sky. And again, the lower back shouldn't arch as you lift. And lower. Switch sides. Right foot down, left leg up. Glutes, neutral spine angle, lift. So the hips at the front should be level across the front. Even if they're low, that's okay, but one side of the hip should not be lower than the other. And come down, centered. Switch, left foot up on the floor. Sorry, left foot is on the floor, right leg is up. Chin down, shoulders are centered. Engage your buttocks and lift, hold. Keep engaging the glutes. And lower. Okay. Left foot is up and right foot on the floor, left leg up. Glutes engage and lift. Shoulders here should be relaxed. Chin toward the throat. This also helps to decompress your neck and down. We don't want to have degenerative discs in our neck. If you do, we can work on keeping your neck healthy. Great. So next we're going to stand up. And before we start our weightlifting, we're going to do one more exercise for the calves, for the ankle joints. So when we do our lower body lifting, we need to make sure that the ankles have the proper range of motion. If the ankles are restricted, then it will cause torsion or rotation, over rotation into the knees and hips. Okay, so we're just going to do one simple thing. And you should be at the wall. So many people do like a calf stretch like this, right? But often people overstretch the back of the knee. So you can hold on to the wall and you're like this, okay? But don't straighten that leg. That'll overstretch the back of your knee. You like this bend. Be sure that the toes are angled forward. The toes should not angle out. And you just hold that position for your Achilles and calves. And it'll help even out the tension of the muscles around your ankle joint so the ankles will move properly. Okay, then we'll switch to the other leg. You can always spend more time. We're just going to go through this a little quickly to get more into our training session today. You'll also notice that the toes will grip. That's really important for our leg strengthening work. Okay, and rest. And then if you just take a few steps around, you'll notice your ankles feel like they're moving more easily. So when we load it, it won't twist your knees. Okay, so we're going to do a deadlift variation. Today we'll do sets of 20 to help prevent muscle loss and actually to build our muscular strength and bone density. Weight, it's up to you. I like to use kettlebells. Kettlebells have a better grip. If you have a heavier weight option, this would be the time to use it. If you use a dumbbell, the grip should be like this. You see like that? And you hold on this way, like this. So you can do it like that. But heavier dumbbells, it's hard to grip onto them. So kettlebells are easier to hold on to. Okay, so we're going to do just a neutral stance like this. Feet just slightly wider than hips and toes a bit angled out. A deadlift, the weight is low. And you just push the hips back and think of engaging the glutes. Make sure you don't do that. If you bend your knees like this, it'll just put pressure into the kneecap. So the action is to push the hips back and imagine you're sitting down and squeezing. Always we think of engaging the buttock muscles. Okay, I'm going to give particular cues here to protect your back. So if you can stand up with the weight, you're standing tall, your chin is tucked in. Okay, brace your abdominal muscles. Just think if someone's going to punch you in your stomach, you're just bracing there gently. Think of bracing your lower back and maintain that all the time. Push the hips back just a bit. Keep the hips moving back. At the bottom, squeeze your buttocks from the sides and stand up, engaging the buttocks. Just keep thinking of squeezing your glutes. You should feel this in your glutes, not so much in the thighs. Focus more on glutes. And rest. Okay, and weight down. Okay, so as you're doing the hip hinging here, it's called a hip hinge. Be sure as well that the toes, so your toes are pressing into the floor, all of them are engaged and the arches are lifted. This set, we'll just walk around for a moment for recovery. Second set, Think of pressing the feet into the floor. You should feel toes outside the foot and heel pressing into the floor. Okay, so we're standing tall, chin in, brace your abs, brace your lower back, hip hinge back, press the feet to the floor and stand all the way up. Press your feet through the floor. Okay, and rest. And walking in between for recovery time. Okay, one more set. You can note the head position, the chin should not be shifting around like this. You're doing it to keep your spine stable. And as you're lifting, and focus on being centered. Be careful of leaning onto one side or using one leg more than the other. And as I do this here, you should be able to see, right? It's not bending your back like that, but rather hip hinge, and then the knees will flex a little. But there should be no variation of the lower back. All right, so this time we'll start with the weight. Keep the chin tucked, brace your abs, hip hinge, using the glutes, pressing the feet, always maintaining that chin position. Chin is in and slightly down. And rest. And now we'll put that weight down. Okay. And then again for recovery, I just like to walk. Most people are not aware, but walking backwards has been shown, or doing exercises moving backwards really does help your brain function. Whenever they do studies regarding backwards movements and brain function, the people who go backwards, they do better than people who only go forwards. So I regularly practice in a safe environment, walking backwards. So for the upper body strengthening today, I will do chest pressing. It's a really universal, simple to apply exercise to get help our upper body become stronger. Push-ups are great, but a lot of people don't really like doing push-ups. And this chest pressing on the floor, anybody can do. If you don't have weights, you could always just use a can of soup or something like that. We're going to be doing sets of 15, just 3 sets. So you use a weight that's appropriate for yourself. A couple of things to pay attention to here. Form is always a critical factor in our training. It's not beneficial to do a lot of reps with poor form. You just end up getting hurt. Rather, we'd like to help get better, actually. So the elbow angle, where should the elbow be? For most people, the most comfortable place is that the elbow is like this, a bit about 30 or 45 degrees to the side. You just know if you go like that, you feel it pinching here. If you're too close, again, it just pinches your rotator cuff joint. If you're here, you have really clean movement of your shoulder joint. We're going to start with left arm pressing. The left leg is straight and the right leg is bent. Initiate with the arm up, so the weight goes right over your shoulder joint. And then you bring the elbow just hovering off the floor, and then press at that 45-degree angle. So the weight should always be directly over your elbow here. Be careful of dropping the weight in toward your shoulder or into your stomach. as you're moving the arm up and down. Okay, switch hands. Okay, left leg bend, right leg is straight, you're in the right hand, right leg is straight on the floor. The arm is straight up to the sky, right over the shoulder. The hand angle, so if you look at your fist, look at your weight. It should be at about a 45-degree angle relative to your body. So when you bring the elbow down, if you bring your elbow on the floor, the weight angle here is the same angle as your upper arm. Okay, is that clear? That will prevent you from twisting the elbow and the wrist. So that's a neutral angle for your wrist and elbow joints. And again, as the weight comes down, be careful of dropping it into your stomach or chest. The people who, the tricep group, people, especially like women later on, are so concerned about triceps. So this is, a very simple tricep strengthening exercise. Do be aware of your abs, like do brace your abs. You should feel your abs engage as you're pressing. Okay, now we'll switch again, left hand, and we're going to focus on that this time. So left leg straight, right leg bent. Now our left arm, keep the chin down, elbow toward the floor, just almost on the floor, but not quite. And then exhale as you press, and as you breathe out, abs engage. Feel your abs engage with the press every time. Okay, now switch, right hand. Right leg is straight, left leg is bent. Okay, so the weight is directly over the shoulder to start out. To set the head, chin down position, head on the floor, then elbow down, and exhale, engage the abs as you press. Okay, and then rest. Now this time for the shoulder joint, left leg is straight, right leg is bent, the rotator cuff joint. I would start with the arm straight up over the shoulder. You have the 45-degree angle. The elbow comes down, and as you're pushing, keep your shoulder back into the floor. Only straighten the elbow as much as you can, keeping the shoulder back. Okay, and here you see if your shoulder comes up, if you can't do that very well, your tight biceps are pulling on your rotator cuff joint, so you probably have some shoulder issues going on. We'll again clear that with regular practice in our exercise sessions. We work on all of these different areas where we've accumulated dysfunction. So keep the shoulder on the floor, keep the shoulder back, you shouldn't pop up. But you should be able to straighten the elbow. Okay, switch arms. So right arm, left leg is bent, right leg is straight. Keep the chin down. And just think press and keep the shoulder back to the floor. Okay, great. And now put the weight down. Now, since we're here on the floor, we're going to work on the hips. We're going to do an external rotation. So if many people are aware of, or maybe have, or do have something called sciatica when you get pain, nerve pain down your leg. So this is a good one to help prevent sciatica for the piriformis muscle. So you start with the knees like this together. Get a pillow if you need to for your head, that's really totally fine. And the top leg, we're going to straighten it like this, okay? So the leg is in line with your body, the foot is flexed. We're not today doing just a leg lift like that. That's not the exercise. We're going to rotate. I mentioned earlier, here's your femur bone. It attaches in your joint of your hip, and you need to engage this muscle right here, right on the outside of your hip, engage that muscle and rotate your leg out. So that's externally rotating the femur. Make sure the hips stay on top of each other, don't lean back. Okay, you ready? So now leg is straight, foot is flexed, knee is straight. Externally rotate your femur and then lift only a bit. And you'll feel your leg will kind of stop. That's where your leg, your femur is in the hip socket, and your piriformis muscle, your gluteal muscles are holding your leg externally rotated, and then leg down. Okay, flex, externally rotate. Use your glutes though. You shouldn't feel it down your leg. Like you should feel it here on the side of your hip joint, slightly back, but not down the leg. And down. If you do, then you're just using your quads when you should be using the glutes. Quads are the front of their leg muscles. Okay, down. And then we'll turn on to the other side. We'll start with knees bent. Okay, and then straighten the top leg. Your leg is in line with your body, foot is flexed, and then you rotate the leg out. You don't worry about your ankle too much, don't twist your ankle, just rotate your femur here, rotate your femur, and then lift a little and hold. Again, you want to feel it here. A lot of people on the right leg down, glutes, externally rotate, lift. It's very common, I've seen this often, people can't get their right hip to engage very well. I think driving is a factor, we sit on that right hip too much. Leg down, glutes, externally rotate, lift. And turn. So turn onto the back. And that massage ball work we did earlier in the hips also is really good for people who have sciatic issues. But these are just generally good exercises for hips. Start with the knees bent, straighten and flex the top leg. Flex the foot, externally rotate and lift. So in terms of bone density, I'll mention this often because most people are not aware of this. There's a part of leg down, glutes, externally rotate, lift. The top of your leg bone, okay, you've got the femur, and there's a neck of a femur that attaches into the sacrum in your pelvis. And that neck of the femur and leg down, glutes, externally rotate, lift. The neck of the femur is, many people, even if they have really good bone density, have a weak, low bone density in the femoral neck. So what does that mean? That means that if you have even very strong bones, sometimes that bone is the weak link. And not that you're going to fall, or you may or may not fall, but that bone can fracture quite easily because it's fragile. You turn over. So why I'm telling you that is here, we are working on exactly that femoral neck and building your bone density in your hip joint. Right leg flex, externally rotate and lift. So that bone that breaks most often because of osteoporosis, weak bone density, you're currently strengthening that bone. Leg down, glutes, externally rotate, lift. The other area where people often fracture because of osteoporosis is in the lower back. And leg down, once more, glutes and lift. And in other sessions, we'll always be working on all of these factors. Leg down. Okay, so next we're going to stand up. And we're going to do one more strengthening exercise here. We just did pressing, so that was a chest press. Next, we're going to do a pulling exercise, but to integrate the lower body. And in terms of the hips, we're going to do a wide stance squat. Now, some people will not have the opportunity to attach a band. If you don't, you might think about trying to work that out for the future, because we will do band resistance exercises often. And okay, so I have this band. You don't want a loose band, so what we're going to do at this moment, you want something that's actually very firm, lots of resistance. If you have a band that has the two handles on the ends, that's a really good one. But you need some place to attach it. So this is a J hook, like this. So you can just throw it over the J hook like that. I have a chin-up bar up here. I'm going to put this, I'm just throwing it over. So you would hold on to both handles. If you have a handle band, you hold on to both, like that with one hand, okay? So what we're doing is this, it's a wide stance squat. If you don't have attached a band to attach, instead you can like just hold on to a chair like this. But you do want to hold on to the chair for today because we don't want to like put too much pressure into your kneecaps. That's why we're doing the holding on with one hand. We're working on the posterior oblique chain, the chain in the back of the body that's diagonally across. I'm holding on with the left hand. And then you take the legs, we're going wide stance, okay, wide. And the toes and knees should always be going the same direction. Let's put the right hand on the abdomen, pull your band in by your side. Your elbow is pulled by the side. And then you go hips back, hip hinge back, release the shoulder blade, engage the glutes and pull. So it's always just think about your glutes, right? Squeeze your butt and stand. Today we'll do sets of 10. Make sure the knees are tracking the same direction as the toes. And you'll notice this kind of band resistant squat, that you don't get so much pressure into your knees and you use your glutes more. That's the purpose. Plus you're getting your upper body strengthening. Okay, right hand. And you're getting your rotational core work. Okay, right hand, hold on. Hips back, release the shoulder blade, engage the glutes and pull. Okay, and rest. Okay, so we're going to do 2 more sets. I just would like to mention about the shoulders. When you're pulling like this, it's important that you don't do this. Like a lot of people go like that. Okay, you shouldn't. That's going to tighten up your chest, strengthen your neck, and put strain around your rotator cuff. So rather, the pulling action is like this. You want to pull from the shoulder blade. You pull the shoulder blade toward the spine. If you do that action, your arm will stop here. If you go like that, then you get the upper traps. Remember earlier, we don't want to do that. You pull the shoulder blade like that toward the spine, okay? Like this, not up here. Okay, left arm. Okay, wide stance, elbows by the side. Okay, and then hips back, release the shoulder blade and pull. Feel the shoulder blade pulling and feel your glutes engaging. You don't need to pull the arm way behind you. That's not exactly what you should do at all. You should not feel it in the upper trapezius. Okay, switch sides, right hand. Okay, start with the elbow by the side, hip hinge, and row. And rest. It was great. And walking for a moment for recovery. You also notice that get your heart rate going a little faster, and you'll get more cardio. You know, people are like, I can't go outside today, I need to do some cardio. Here you just do a few sets of this and it will help stimulate cardiovascular conditioning. Left hand. Okay, step back, you've got your wide stance. You've got tension, your elbow by the side. And if you don't have the band, you're just holding onto a chair, that would be fine. But hip hinge, release the shoulder blade and pull the shoulder blade back. Keep the shoulder down from the ear, pull the shoulder blade back. Keep the chin tucked in. The chin shouldn't go forward. That's better. Okay, switch hands. Spread your toes, use those toes, keep your arches up. Okay, hip hinge and shoulder blade pull. And rest. And walking. Okay, let's just take another minute here if you have time. We'll just do something for rotator cuff. Many people, have rotator cuff issues, shoulder issues, can't move my arm up properly. So we'll try to fit these in at the end of the sessions as well. So you should just use a very light weight, like very light, especially if it's your first time, like 1 or 2 pounds. We're just doing a shoulder hold, okay? So what we want to do is strengthen the muscles around the shoulder joint to hold your arm and your shoulder joint properly. Because if it's really sticky, you know, you can't get your arm up, things like that. The action is just a hold. We're going to go through this twice. You just hold the arm like this, just directly in front of the shoulder. That's it. You ready? Start with left arm. So you just lift the arm. Wait, brace your abs, use your glutes. Don't lock the knees, right? Your knees should be like a little bent. Don't lock the knees out like backwards like that. That'll jam up the lower back. Okay, great. Okay, so our knees are soft. We've got our glutes. Your abs are going. You lift the arm directly in front of the shoulder and hold. Now keep the shoulder, your arm bone, keep it back in the rotator cuff socket here. So you should feel the muscles around your rotator cuff joint. And the elbows straight. Okay, if your biceps are really dominant and tight, then you'll feel your biceps engaging. You really shouldn't feel that. You just want shoulder, forearm, yeah. Okay, now we're going to rotate the arm out. Are you ready? So here your palm is facing down. And we're going to take your arm directly out to the side like this. Palm is facing forward. Palm of your hand is facing forward, thumb up. Right. Now hold. Oh my God. Now here again, you're going to feel rotator cuff. And you shouldn't feel, you should stretch your chest nicely. So you want to reach this time from your chest and hold. This here you'll notice if your pecs are tight, right, it's pulling on the front of the shoulder. So we're trying to strengthen the shoulder so you don't have to do that. Try not to let the head go forward here. Okay, now we're bringing the arm back to middle and down. Okay, other side. Toes are angled forward. Straight elbow. Engage your glutes and abs. Don't just lift. And that's good. Arm directly in front of shoulders. And hold. The shoulders and hips should be square forward. Your knees are not locked. Your glutes are engaging. Your abdominals are engaging so you don't feel it in your back. Okay? And we're taking the arm, so you bring the straight arm out to the side. Here the palm is facing forward and you just reach across the chest. So if you're pretty good with your shoulders, you should be very straight across here. If your pecs are really tight, then you won't be able to get the arm out directly out to the side. It'll be forward, which is okay. We'll work on that again over time. All right, so thanks very much for coming. We'll just do a weekly exercise sessions like this. Please join in. At least you'll make 1 hour of the week to build up your bones and strengthen your muscles and build up your better alignment. And the goal is here to be more competent in our lives, or if you're a competitive athlete, to win. Good luck. Have a great day. See you next time.